The World Health Organization announced Friday an emergency committee will be assembled to discuss the dangers of a new virus threatening the Middle East. MERS, or Middle East Respiratory Syndrome, is a virus similar to SARS or the common cold. The WHO has confirmed 79 cases since the virus appeared last September, with 42 fatalities. The virus drew international attention when it developed the capacity to transmit from person to person. Speaking to the press in May, WHO Assistant Director Keiji Fukuda said global awareness is a critical part of containing the virus.
Several urgent actions are needed. The most important ones are the need for countries, both inside and outside of the region, to increase their levels of awareness among all people.
Now the WHO is convening an emergency committee to determine whether MERS poses a significant threat to world health. Depending on what it finds, the committee could advise temporary safety measures to all member nations if the virus threatens to become a pandemic. But concerns about the danger of MERS might be premature. A study published in The Lancet on Friday suggests the MERS virus does not spread at pandemic rate. And a Fox News medical analyst says it's too early to start panicking over MERS.
I still think the biggest virus here is fear. And we get one of these every couple of years. I don't think we can keep comparing it to SARS.
Still, the threat of the virus is worth keeping an eye on, especially with an upcoming global event drawing crowds of millions to the Middle East. Digital Journal reports millions of Muslims are expected to celebrate Ramadan by making a pilgrimage to Mecca and Medina between July 9th and August 7th. If the virus spreads among the worshippers, it could, quote, trigger mass global outbreak of the illness as infected pilgrims returning home after the pilgrimage spread the infection. Although that's, of course, a worst-case scenario. The WHO Emergency Committee is scheduled to meet July 9th and July 11th. For Newsiam's Zach Toombs.